Hello, my name is Dr. Dewan S. Raja. Today I will discuss a few multiple choice questions in upper limb anatomy from question number 21 to 30. And I will put all the answer keys in the description along with the reference books for your kind information. Okay, let's start solving the multiple choice questions. Question number 21. All of the following structures are contents of the carpal tunnel except one. The exception is what? 4 tendons of the flexor digitorum profundus, 4 tendons of the flexor digitorum superficialis, the tendon of the flexor pollicis longus, the ulnar nerve. So what is the exception? This is carpal tunnel. So nerve should be the median nerve, not the ulnar nerve. So this is the exception. This is the answer. These all are contents of the carpal tunnel. Question number 22. Which of the following muscle is the major abductor of the arm and is innervated by the axillary nerve? Okay. Major abductor. Trapezius, levator scapulae, rhomboid major, deltoid, rhomboid minor. What is the chief abductor of the arm? Answer should be what? Deltoid. Question number 23. Which of the following rotator cuff muscles in the shoulder is innervated by the axillary nerve? Supraspinatus, infraspinatus. Teres minor, subscapularis. Supraspinatus, infraspinatus innervated by the suprascapular nerve. Subscapularis is innervated by the upper and lower subscapular nerve. Teres minor is innervated by what? By the axillary nerve. Okay, here question number 24. A nerve acts as a key to identify the components of the brachial plexus. Pierces the muscle that takes origin from the tip of the coracoid process. The nerve is what? Okay, it pierces the muscle that takes origin from the tip of the coracoid process. Okay, what is that? Dorsal scapular nerve, ansa cervicalis, accessory nerve, musculocutaneous nerve, long thoracic nerve. What is the key? To identify the components of the brachial plexus. Answer should be musculocutaneous nerve. It pierces the coracobrachialis muscle. Coracobrachialis is one of the muscle which takes origin from the tip of the coracoid process. Another muscle also takes origin from the tip of the coracoid process. There is the short head of the biceps brachii. But coracobrachialis is the muscle which is pierced by the musculocutaneous nerve. So this is the key to identify the brachial plexus, and this is the answer to this question number 24. Okay. While attending the gym means gymnasium, together a dental student observed the distinct outline of a vein in his friend's chest between the pectoralis major and deltoid muscle. Which of the following vein passes through the clavipectoral triangle between the deltoid, pectoralis major and the clavicle, opening into the axillary vein? What is that vein? Subclavian vein, cephalic vein, median cubital vein, basilic vein, brachiocephalic vein. What is the vein? Answer should be cephalic vein. Question number 25. Cephalic vein. Okay, we got that. We'll go to the next question, 26. A 15-year-old girl has no pectoralis major and minor muscle on the left side, has hypoplasia of the left breast, absence of left anterior axillary fold, lacking of second to fourth ribs on the left side and waving of the left fingers. What is your clinical diagnosis? Is it Poland syndrome, Turner syndrome, super female, Down syndrome? What is the diagnosis? Poland syndrome. A is the answer. 26 is the A. Poland syndrome. Turner is not like that. So pectoralis major minor and hypoplasia of the left breast and absence of left anterior axillary fold. This all belongs to the Poland syndrome. They are usually associated with defect in the respected hand and the fingers, like waving of the left fingers. Tinel sign is elicited by percussing where? Percussing on the likely on the course of what? On the course of the median nerve. B is the answer. 27. B. Median nerve. It will diagnose a patient with carpal tunnel syndrome. Okay, that is the Tinel sign. And we actually percuss on the median nerve B. Following a fall on the outstretched hand, a 20-year-old healthy young man had severe pain in the anatomical snub box. Okay, what is my anatomical snub box? Anatomical snub box is this area. This is the anatomical snub box area. Okay, and what is the bone in the floor of the anatomical snub box? Okay, this is the anatomical snub box. We have to know that part, and we must know what bone is present at the floor of the anatomical snub box. Okay, let's start. Following a fall on the outstretched hand, a 20-year-old healthy young man had severe pain in the anatomical snub box. Initial plain X-ray failed to detect any bony fracture. It is just a very fine fracture, so it may not be found in the plain X-ray. Even it may take few weeks. The doctor advised him that the fracture line may appear later or it can be detected early by MRI or bone scan. What is the clinical diagnosis? Okay, what bone is present in the floor of the anatomical snub box? You must know that part. Our diagnosis would be like that of this question number 28. Fracture of pisiform bone, fracture of scaphoid, fracture of the hamate, fracture of the capitate. So answer should be fracture of the scaphoid. Okay, so here we'll find out that which of the following tendon passes through the groove medial to the indicated tubercle. Tubercle is this, and this is the groove here. Here's the groove. Okay, so what is that tendon? This tendon goes along this way and it goes up to the base of the distal phalanx of the thumb. Okay, so what is that structure? That is the, what is that? Is it extensor carpentalis longus, extensor digitorum, extensor indicis, extensor pollicis longus? Answer should be extensor pollicis longus. A is the answer. Question number 29A is the answer. Okay, now I'll go to the next question. Okay, identify the indicated red structure in the proximal carpal tunnel of a CT scan. You have to identify that structure. This is the carpal tunnel. Okay, so you have to identify the structure. What is that structure? Tendon on the flexor pollicis longus, tendon on the flexor digitorum superficialis. These are this. Tendon on the flexor pollicis longus is this. Tendon of the flexor digitorum superficialis at this here. Okay, tendon of the flexor digitorum profundus at this. Okay, we have 4, one will split later. We have also 4, 2 will split into 2 later on. Okay, ulnar nerve, median nerve. What is this structure? This is not tendon, this is nerve. Nerve is superficial in carpal tunnel. Okay, that may be irritated in carpal tunnel syndrome. What is this structure? This red structure. This is the median nerve. Median nerve is compressed in carpal tunnel syndrome in the underneath the flexor retinaculum. So our answer should be median nerve. Okay, and that's all about the multiple choice questions from 21 to 30. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. And I have put all the answers in the description along with the link for the reference book for your kind information. So thank you now. Bye.